Hey doctors, welcome back to DOCSHAALA. So today in our video we are going to see about a interesting topic, that is buccal corridors from the aspect of orthodontics. So buccal corridors nowadays has become a very important thing because we are so much involved in smile designing procedures to our patients in our day-to-day lives. So let's see what buccal corridors are. So buccal corridors is also known as negative or black spaces. So it is also known as negative or black spaces. It were defined by Frush and Fisher. So it is the spaces between the facial surfaces of the posterior teeth and the corners of lip when a person is smiling. Okay, the person has to smile. So when this person is smiling, it is the spaces we find between the facial surfaces of the posterior teeth and the corners of the lips. Okay, the perceived dimensions and depth of the shadows in the space depend on several factors, okay, such as the width of dental arches, the sagittal position of the dental arches, the range of horizontal movements produced at the lip commissure, and the type of lighting we use during the assessment and of photographic session. So both absence and enlargement of buccal corridors negatively affects the aesthetics of face. That's why we keep in mind while designing the smile to have optimum amount of buccal corridor visible. So the smile with lack of buccal corridor is known as denture smile. So this is what is buccal corridor is. So as you can see in the image, so this is the corner of the lip. These are the facial surfaces of the posterior teeth, right? So this is the space that we can see, the negative space or the blank space we can see. So this is what is called as buccal corridor. So this is the inner commissural line and this is the outer commissural line that we consider while measuring the space. Okay, so you can see inner commissural line is towards here, whereas outer commissural line is at the corner of the lip. Okay, inner commissural line is based on the last teeth that we can see. So you can observe on this side we can see this molar surface area. So there it is drawn, and here also we can see that. So there it is drawn. Okay. So here in the images you can see the various types of buccal spaces. So here you can see the narrow space. So the space is not much visible, and here it is very wide. It's like a hole here. Okay, like compared to this it's wide, so it is a medium width one, and here it is very wide. You can even see inside what it is there. You can see the entire dentation. It's like showing entire dentation, right? So this is what is narrow, medium width and wide buccal corridors look like. So here also you can see narrow one, medium narrow, right? The medium ones, medium broad and broad. In this broad, the buccal corridor is not at all visible, right? So this is what we can see. So an average buccal corridor space in Indian population with class 1 occlusion is 9.58%. Okay, that is medium broad smile that we have seen. So that is the average corridor space that we see in Indian population. Okay, in males it is narrower, counting to 8.49%, than in females. Females it is around 10.67%. So difference between both is statistically not much significant, right? It is only a 1% difference. So a question was asked, that is an image based question. So the figure represents, so you know what the figure represents, right? Is it subbuccal corridor connecting upper tuberosity and lower back arch? Is it buccal corridor? Is it subbuccal corridor connecting lower raphe to the upper gum line? Or is it suboptimal corridor? So it is buccal corridor. Okay. If you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram handles at DOCSHAALA for dental content and at DOCSHAALA Medical for medical content. You can also follow us on Telegram. Thank you.